Welcome, MS translators, to another one of our video series covering presentations that we heard at the MS Virtual 2020 conference. It's my great privilege today to be joined by Dr. Kassandra Munger from the Harvard T.H. Chan School of Public Health. Dr. Munger gave a fantastic oral presentation during the conference, and she really thankfully accepted our invitation to join us for one of these interviews, so we thank you very much for that. Kassandra, can you maybe start by just giving a little bit of an introduction to yourself and your general research overview?
Yeah, sure. Well, thanks for asking me to, be on MStranslate. This is really great. So I'm a senior research scientist and epidemiologist in the Department of Nutrition at the School of Public Health. I'm also part of the Neuroepidemiology Research Group. And while I study MS within that group, others are working on Parkinson's disease, ALS, Alzheimer's, depression. So we are a pretty diverse group in terms of the diseases that we study. But I have been studying risk factors for MS and MS progression for the past 20 years or so, mainly focusing on associations with Epstein-Barr virus infection, obesity, vitamin D, and other aspects of diet, such as the polyunsaturated fatty acids.
Okay, fantastic. So they're obviously really interesting areas, and we've probably a lot of people in our community would have heard a lot about these different risk factors. I guess, can you tell us a little bit about the background to some of the projects that you're working on at the moment in terms of what got you interested in those areas?
Mm-hmm. Yeah, well, one of the projects I'm working on right now that I'm really excited about is looking more at the association between polyunsaturated fatty acids and risk and progression of MS. And we got into this because back in 2000 or so, before I was at Harvard, the group had conducted a study among the Nurses' Health Study cohorts, which are two large cohorts of women. And at the time, I think they had about 200 cases of MS. And they were looking at dietary fat and risk of MS. And there was this signal, this inverse association that they saw with one of the polyunsaturated fatty acids that we call alpha-linolenic acid. It's an omega-3 acid. And the finding was the magnitude of the risk reduction was quite large, but the confidence interval of the finding itself was not statistically significant. Mm-hmm. So just a few years ago, we decided to redo that analysis now that we have more than double MS cases that have occurred in these cohorts since the initial study. And so we took a look at it, and the polyunsaturated fatty acid, the ALA, the alpha-linolenic acid in particular, came out as still inversely associated with risk of MS. And about the same time that our study was published, there was also a study from the Autoimmune group in Australia, where they found similar findings, where they were also picking up that polyunsaturated fatty acids may be associated with a reduced risk of MS. And so that kind of, grabbed our attention with the, especially with the alpha-linolenic acid. And then there was a group in Norway. They had a clinical trial on omega-3 fatty acids and MS. And they decided to measure the blood levels of this alpha-linolenic acid, polyunsaturated fatty acid, and see if it was related with any clinical or MRI outcomes in the patients. And they found that that among MS patients in their study, those that had higher blood levels of this polyunsaturated fatty acid were less likely to develop new lesions, had a lower risk of relapse over the 24 months of the study. So we were in a position, based on some of our previous work in our collaborations with Bayer Pharmaceuticals, we have access to the benefit study samples and data. And so we decided that we would put in a grant to look at polyunsaturated fatty acids in the blood. We've got four blood samples that were collected over the first 2 years of that clinical trial. And we have up to around 11 years of post-randomization data. So what the clinical and MRI outcomes for the majority of the people in the clinical trial, we have that information for over about 11 years. So right now, we're still in the data gathering phase, but it's really exciting because some of the data is starting to come back now. We were delayed a little bit by COVID because all of the labs shut down, and so we're still the lab is still analyzing some of the samples, but they are starting to wrap up. I'm hoping they'll be done by the end of 2020, if not early 2021, and we can really start getting into this data and hopefully have something out in the next year or so about whether these fatty acids may be beneficial to people with MS.
Yeah, fantastic. I mean, it sounds like a really interesting area and lots of different pieces of the puzzle starting to come together. And it sounds like you're going to have a lot of data to be able to use in this study. So it's going to be really interesting. And we look forward to hearing what the results of that will be. I guess for people who are currently living with MS in the MS community, what are the potential outcomes of a study like this?
So the data that we have available to us, we'll be able to look at a variety of outcomes. Benefit was a clinical trial in people with a clinically isolated syndrome. So we'll be able to look to see if polyunsaturated fatty acids predict conversion to MS. And we also have other outcomes such as EDSS was captured at every visit. We know when they had relapses, how long those relapses lasted. We also have MRI data on them, so we do know whether and when they develop new lesions over the course of the follow-up. We have brain volume measures, the lesion volume measures. So in addition to, they also completed the MS functional composite and some other cognitive related tests. So we'll be able to look at all of those outcomes in relation to the polyunsaturated fatty acids. And I think one other big advantage with this group, using these data, are that we've previously conducted vitamin D studies on them that are very similar in design to the polyunsaturated fatty acids. So we'll be able to also look and see if there's any interaction with vitamin D levels, or if the vitamin D levels affect how the polyunsaturated fatty acids may affect these outcomes in people with MS.
Okay, excellent. So I guess next steps and future directions, we've sort of already talked about that a little bit in terms of this study and where it's going. But did you want to touch on any of that? You obviously talked about a number of research interests that you've got at the moment. And I know that it's MS Virtual 2020 presented a few results on EBV. Is there anything in those sort of areas you can share with us briefly?
So, so in terms of EBV, we are trying to put together a study to really look at people who are EBV negative, and be able to follow them over time to see if they become EBV positive, and if that shift from EBV negative to being infected and showing EBV positivity, if that's associated with an increased risk of MS, to show that the actual primary infection of the virus has to occur before MS occurs. Yep. And it's a little tricky, with the prodromal phase. I know you've spoken with Dr. Drummond, and so trying to tease all of that out right now. And so I think that's where the EBV research has to go now, I think, is really working on proving causality, or at least conducting those studies that can get us even closer to implicating EBV as a causal factor, and not the only factor, of course, but maybe not even the only virus, but certainly having an important role.
Yeah, there's been a really interesting shift in the EBV story over the past few years, so from sort of back when I was starting doing research many years ago now, but more so, I know a few studies that were presented at last year's ECTRIMS meeting, suggesting that they were looking at cohorts of people with MS and finding 100% of people were EBV positive, and that had been a shift from data a while back that was suggesting it was 95% or 98% or something like that. And the shift to 100% is quite important.
Right, and I think some of that probably has to do with improving assays, and they are more sensitive now, and because a lot of the studies that you're referring to that would find only 96, 97% infected. I mean, those were done in the 70s and the 80s, and a lot of advances have been made since then. So I think that we're seeing that it could be an artifact of laboratory assays and not necessarily this real shift in terms of people with MS becoming EBV infected. If that makes sense.
Yeah, certainly. I mean, we know that this is a real area of interest for the MS community, environmental factors and the role that they play not only in susceptibility but also in progression. We know is of great interest to people, so I'm sure they will be very interested in your work. I guess it's sort of the last question we always like to know, because we know our community is very engaged and wants to support research as much as possible. Is there anything that people with MS can be doing to help your research?
The support is really wonderful. I know even here in the U.S. that the MS community is really engaged in the research and in contacting us. Like we do get emails from the community and showing a lot of interest in our work and how they can help us move that forward. And I think one way in which people can help if they're comfortable doing it is, to participate in these studies if they're asked. If another study comes along like Autoimmune in your area, or if it's expanded into another place, it's vital that these research projects have that they represent the diversity of the MS patients that are out there, and the more MS patients who participate, the better the results will be. And so I think that that's one really big way that the MS community can support research.
Yeah, definitely. I mean, being active, being enthusiastic, and engaging with research when you hear about it, and then participating are the two big things that we always advocate for as well. So, look, thank you for giving up your time today to share your research with us. I know that the MS community is going to be hugely appreciative of it. And yeah, thank you for all of your hard work in this area, and we look forward to hearing more about all of the research outcomes that you have in the future as well.
Oh, well, thank you for having me and inviting me to be here today.
No worries at all. Thanks, Kassandra.
Okay.